we probably will have some additional folks joining us. I expect to have a couple folks join us as well. And my apologies initially for making a short transition time from in-person to virtual. However, a few of you on the screen I know have a sizable distance to travel, and with the weather really uncertain, I didn't want to put anyone in harm's way and make you feel like you had to be here if we remain in person. So thanks everyone for shifting at the last minute. We will forego our next in-person meeting until June. So we won't try to schedule it in February. Who knows what the weather will still be like in February. So we'll do February and April virtual again, and then hopefully be able to have our June meeting in person as well. So what I would like to do, since we're virtual, I want to remind you all a couple things. This is an extension of the KBE, Kentucky Board of Education. So it is an open meetings, it follows our open meetings law in Kentucky. I would encourage you to keep your cameras on, if at all possible, due to that law, and also keep your mics muted unless you're talking or have a question to ask or whatever. Our agenda, hopefully everyone received the agenda today. We do have one edit on the agenda, and we were going to also talk about Partners for Rural Impact, and they were unable to attend and join us at the last minute. So we will potentially look at having them on in the near future to hear about what's going on in the southeastern part of the state in regards to their initiative and work. What I would like to do first is go ahead and call us to order. And I think we may have a few new faces. So I'm just going to ask if we can follow our attendance group member who is on the meeting. And I'll go ahead and start, and we'll just go alphabetically down. If you'll introduce yourself, your organization, agency, and or where you're located in the state, that may help folks, again, continue to put names and faces and locations together. I'm Jim Tackett. I am the School Health Branch Manager at KDE, and I actually live in Somerset. And Bart, I think you're next, and then I'll mute and let everybody self-direct.
Hi, Bart Fleener, Green River Regional Educational Cooperative in Bowling Green, Kentucky.
You're going by last name. Does that help? Down the participant order? All right, I'll go.
Very quiet. I thought Jim had asked me to sing a song, and I just misinterpreted what he said about the introduction.
You just had to, yeah,
feel better now, Stephanie.
Explain the life story, all that. Stephanie Bungie, Healthy Schools Project Director, part of the School Health Branch at KDE.
I'm Matt Cooper. I'm the Director of Policy at KSBA, and I'm in East Kentucky in Menifee County.
I'm Crystal Dillingham. I am the Health Service Representative with KDE for the Central Kentucky region.
Mike Ford. I am with the Kentucky Association of School Administrators. Our offices are in Frankfort, but I actually reside in the Florence area up in Boone County.
Abby, I think you're next.
Oh, I was looking. I thought it was Catherine Embry. Sorry. I'm Abby Henshaw. I am Health Program Administrator with KDE School Health Branch, and I am in the Western region.
Hi, I'll go. My list is all out of order, so that's why I'm struggling. Katie Embry, Division of School and Community Nutrition.
I apologize, Katie. I did not mean to jump the gun. I was trying to go through the screens as well, and I'm sorry I jumped in front of you. I apologize.
No, my name's at the very top. So I think all of our lists look a little bit different. So
Am I next? I'm not even sure here. Matt Ross, I'm the Associate Commissioner in the Office of Finance and Operations.
Well, I'll just follow Matt since he's a good one there. Hi, I'm Michelle Malico. I work for the Kentucky Department for Public Health. I am the School Health Section Supervisor. I'm glad to be here.
I guess I'll go ahead and go. I'm Julie Pyle, and I'm an at-large board member on the Kentucky Board of Education.
Hi, I'm Lauren Moore. I'm the Director of School and Community Nutrition at KDE.
I'll go ahead and go. I'm Angela Stark. I'm Healthy School Specialist on the Healthy Schools grant with Stephanie in Fayette County.
I'll go on and go. I'm Angie McDonald. I'm the state school nurse consultant here at the Kentucky Department of Ed, and I live in Mercer County.
I'm Bethany Thomas. I'm in Department for Public Health, School Health, work with Michelle. We are based out of Frankfort, but we are a telecommute, and I live in Somerset.
Kelsey Rutledge, Baptist Health Deaconess, Madisonville. Kelsey Rutledge with Baptist Health Deaconess in Madisonville, Hopkins County.
Stephanie Barker, apologies for not having my camera on. I'm a bit under the weather today, but I am with the Kentucky Out of School Alliance, and I am located in Richmond, Kentucky.
Hi, I'm Rachel Jenga. I'm with the Kentucky Department of Education, and I live in Versailles, Kentucky.
Hi, I'm Lindsay Swartz. I work as the Policy Advisor for the Office of Finance and Operations at the Kentucky Department of Education.
Lauren?
Yeah, I wasn't sure what the order was there. Sorry. Lauren Penrose. I'm a school mental health program administrator with the Department for Behavioral Health, Developmental, and Intellectual Disabilities. And I also serve as the mental health co-coordinator for the Project Aware grants. Thanks.
Tina?
Good afternoon, folks. Tina Robbins. I'm also with the Kentucky Department for Behavioral Health, Developmental, and Intellectual Disabilities. I'm currently an executive advisor in that office. Good to be here.
Okay. Caitlin? Did I miss anyone? Okay.
Christina Weeder with the Division of Student Success.
Sorry,
I don't
Christina.
even, that's okay. Usually I'm at the very bottom, but it doesn't go past Angela Stark. So I couldn't see when I was supposed to go since Angela already went.
Thank you all again for hopping on today. We'll go ahead and get started. I want to turn the first part of the meeting over to Stephanie and Angela on our Healthy Schools work, our CDC grant or cooperative agreement that we are currently in year 3 of. And they're going to provide some updates on what's going on in Fayette County and then some other grant updates for the group. So Stephanie, am I turning it to you first?
You are. I'm going to share my screen. All right. I'm assuming that's good. If not, just yell at me. So we haven't done this quite in this way probably in about a year when we had our CDC project officer at the time was doing a site visit. So it was about a year ago that she was there. So we thought it'd be a good time to kind of give a full update of the cooperative agreement that we have with CDC. Just as a brief reminder, because I know some of you familiar, some of you not as familiar with the funding that we received from the CDC. It was a 5-year cooperative agreement starting in June of 2023 and is scheduled to run through June of 2028. I think as all funding at the federal level, there's no guarantees at this point, but we are just trucking along and continuing the work as best we can. The focus areas of the grant, while the work is under the umbrella and modeled after the whole school, whole community, whole child model, there are some different focus areas within the cooperative agreement that we have, which include physical education and physical activity, nutrition, the management of chronic conditions, and out of school time. So that's why the work focuses on those areas, because that's what's called out in the cooperative agreement with CDC. And there are two main strategies within the cooperative agreement. One is statewide support. So again, work that's being done across the state. And then implementation in a priority LEA or district and this corresponding schools within that priority district. And for this cooperative agreement, that is Fayette County. So here are the work plan activities. So just to kind of give you a update, a lot of this is just really dating back, I'd probably say through the beginning of our year 3 of 5, which began June 30th. So really it's been about the past 5-6 months that a lot of this work that you're going to see has taken place. So under strategy 1 for statewide support, the first main activity that we have is providing statewide professional development and technical assistance. So within the past, 5-6 months, worked with the rest of the school health branch at KDE, and there were 3 regional district health coordinator meetings. In October, we worked with Kentucky SHAPE, which is the State Association for Health and PE Teachers. And there was a half day on, I think it was October 19th at Murray State, where there was a professional development event for teachers. And then the next day, that Monday, the 20th, there was a full day future professionals event. So Kentucky SHAPE gets together all the future professionals, as many that can attend from across the state at the different colleges and universities, and provides them an all-day training and just kind of what to look for as they're going through school and when they're looking for jobs when they get out of school, et cetera. So that was back in October. And then in November, and I'm sure when we do partner updates, Stephanie can give a lot more detail to this, but we worked with Stephanie and Kyosa to have a virtual summit for out of school time providers. And that was November 12th and 13th. It was a 2-day event. And again, it was virtual, but the platform was amazing. The sessions were great. And so I think the event went really well, but Stephanie can give you more details later on. And then some technical assistance. A lot of technical assistance is just, who calls, who emails, who needs support. That's what I'm there for at a state level. So that, happens quite often. Some specific things, we went with Lauren and Katie, and we did a panel at the Kentucky School Nutrition Association conference, answering some questions about wellness and wellness policies and things like that. And then we always try to participate in Kelsey's group with his, with Baptist Health Deaconess Madisonville, going out to either Madisonville or Ken Lake when they have their professional development events that they host for teachers or their champions in the mini schools that they're working with. So those are kind of the highlights, main things that have happened so far with professional development technical assistance. Activity 1B is that we have to establish and maintain school health councils and teams, which at a state level, you can imagine is a little more difficult to work directly with some schools randomly across the state. So we have found a really good model. In the past couple of years have worked directly with Northern Kentucky Educational Cooperative and with GREC. Bart and Cassie are amazing, and they worked the past couple years with some of their member schools and working on school health teams and assessments and action plans and implementation of those action plans. And it was really great this year when we reached out again to all the co-ops. We had more that were interested in. So we're going to work with 6 educational cooperatives and starting hopefully in January. The contracts are getting there. So hopefully those will be done soon and they can begin that work, working with about 4 schools in each of the areas that the co-ops service to do that work again. So we're excited about that. I think there's a lot of good things that come out of there, a lot of good relationships and a lot of work from the ground up. Activity 1C, establish or maintain a state level school health leadership coalition. Well, that is this group. So that's an easy one, but that's something that we've, Kentucky's had this group in place since 2011. And so that just continues on. And there's a lot of states that actually struggle with this activity within the work plans. And luckily in Kentucky, this is one of the things that we do well, is definitely working with partners. So we've obviously had a couple meetings, and we try to meet at least 4 times within the grant year. Continuing on, activity 1D, establish new and strengthen existing partnerships. Partnerships is huge in this work. Obviously, we don't get a lot of funding, and collaboration is key with any of the work that we do, especially in school health. So we have a lot of partners across the state, within actually the country that we work with to utilize and do a lot with this work. Alliance for Healthier Generation is one of them within their system because it's so user-friendly to do those assessments and action plans. We've just begun partnerships with the University of Kentucky's College of Public Health, their I Can End the Trend and I Champion Health programs that they have going on. So figuring out ways that we can support each other. The Department for Public Health obviously works with Michelle and her group a lot, but I also participated in the Oral Health Strategic Plan a couple months ago. Shape America is the national organization for health and PE teachers, and they are actually a non-governmental organization, an NGO funded through CDC, the same funding where ours comes out, same section, excuse me, that our funding comes out of. And Shape America has an initiative called Leading Healthy Schools, where they work with school administrators from across the country that apply and want to improve nutrition, physical activity, maybe it's staff wellness, et cetera, in their schools. And we actually had the principal at Elkhorn Middle School applied and was selected. So she is working with Shape America at a national level, but to increase some physical activity and nutrition education within her school. And then we have another great organization, the Society of State Leaders of Health and Physical Education, that Jim and I are a part of. And that's really connecting with leaders that are kind of in our same positions across the country and other state departments of ed. And then, of course, our Family Resource Youth Service Centers are huge partners of ours, and their work, just coincides so much with the WSC model. Strategy 2, in a minute, Angela will share more, but strategy 2 is that specific work, the implementation that's occurring within Fayette County, and Angela just does amazing things there and is building relationships and working with schools directly and providing a ton of technical assistance along the way, and is really making a huge impact. And we know this, but you see firsthand that it does take a while. It doesn't happen right away, and her and I have both had to realize that, but slowly you start seeing these little things change. So it's really rewarding. Again, it does take a lot of work and effort, but it does make some really great changes. So similar to that of strategy 1 for the statewide support, we've got providing technical assistance and professional development in Fayette County. Fayette County is great. They have a PD day in August set aside, and there's a track specifically for health and physical education teachers. So those teachers get content specific PD, and Angela organized that. She also did a presentation to paraprofessionals in Fayette County as well during that week, just figuring out ways that they can help their students that they're servicing participate in PE. There are additional PD days within the Fayette County calendar. So kind of after like a long break, there's an extra day students are out and teachers are getting professional development. So like there was one the Monday after fall break, there will be one the Monday after winter break, after spring break, et cetera. But luckily for half of that day, Angela is able to, again, provide those teachers with some content specific professional development or professional learning networks, however that gets designed. So there was one in October and we still have 2 more to do this year. And then of course, she's again, visiting schools all the time. For activity 2B is providing follow-up support after those professional development events. We know within a professional learning framework that the follow-up, the coaching, et cetera, is key for implementation and impact of that professional development that was learned. So we send out some surveys after the PD events. And then again, Angela provides any resources or support she can that's requested from the teachers after those events. Activity 2C and 2D, it's supporting the assessment of school health policies, practices, programs, and services. So Angela's working, especially the month of October, for the schools to complete the Alliance for Healthier Generations Healthy Schools assessment so that the schools have completed the assessment and we can really utilize that data to see where we can make some improvements and provide some support within the schools. So she's worked with those schools in the assessment. We just got that report back from the Alliance recently. And then she supports the implementation of all those policies, practices, and programs. We have split up Fayette County because it's very hard to work with that many schools within one school year. And so she finds roughly 10 schools each school year during this grant cycle to work closely with their committees, their assessment, and their action plan implementation. She helps any of the schools in the district, but working specifically with about a core group of champion schools each school year, because that's part of our CDC requirement is we have to work with at least 75% of the schools within Fayette County to do all this work of assessments and action planning. And then we have our state council, this group right here. She has a district wellness council that meets quarterly and it constantly has new members on it. There's tons of community partners that want to be involved and has a representation from all the components of the WSC model as well. And they've, at our last meeting, looked at the wellness policy because they were making some updates in the wellness plan that they're going to be implementing this school year. And then I will turn it over to Angela. Angela, I'll drive it and you just tell me when to change the slide.
Okay, awesome. Thanks, Stephanie. I absolutely love being part of this grant and the work I get to do every single day. So this is actually the next few slides are the board report that we're going to do on to our Fayette County Board of Education on December 18th. Give you an update. So these are the 9 schools I worked with last year, our 9 wellness champion schools. The ones with the stars were the Alliance for Healthier Generations deemed America's Healthiest Schools. Stephanie, we go to the next slide. I can't remember if I had a slide in there.
It might be the next.
Yeah, right, go back.
Okay.
Yeah. But the most schools we've ever had be an award winner with the Alliance for Healthier Generation is 1. So this year we had 8. So these schools, all the ones with the stars, all plus a couple others met at least one of the 9 categories. And I think I have a slide maybe with the 9 categories. I can't remember. But anyway, so I was super excited. Steph, you can go to the next slide and I'll show the schools. These are 10 schools I'm working with this year. Surprisingly, high school is a whole different ballgame, but I'm super proud that I have some great wellness champions. And notice I actually have 3 of our 6 high schools on here. And I had 1 high school last year. So I'm hoping, I feel like I've made some good progress with the high schools so far. But these are the schools I'm working with this year. And like Stephanie said, I go to whatever school needs me, but these are the ones that I work really hard with champions in the school. All right, Steph, next slide. Oh, I guess I do not have it. But anyways, So like Stephanie said, we have a district wellness committee. I'm actually pretty proud of this because I've been on the wellness committee for many, many years, and we have one just when we have to review the policy. And it wasn't very representative of what the work going on. And then the committee would just end. But this committee has been totally committed. And like she said, we keep adding new members to our committee and the work we're doing. I feel like they feel very valued because their input, we really listen to the input and make sure we're taking action based upon that. But you can see the work we've done. We district wellness reviewing and revising the district wellness policy. We've created action steps for all 4 of those categories. We've discussed doing a district-wide wellness event in the spring. I'm not really sure where we are in Fayette County Schools right now, if that's feasible. But we did start initiated an employee wellness event, Pickleball Palooza last year. And we're going to do that again this year and teaching our staff, our employees, how to play the game of pickleball. And if you already know, you come and just connect with other employees in our school district. We also did a yoga event in November. So we're trying to do more wellness events planned by the school district that are just free for our employees to go to. So you can go next slide. So here are some of the things I've been working on in the Healthy Schools work. I work a lot with health and PE teachers. We have brand new Kentucky standards that were adopted on October 17th of this year. And so working with our teachers on how to teach the standards, what are the differences in the new standards versus the old standards, equipment needs to do those standards. That's been a big thing. Adaptive PE. I'm not gonna lie, we don't do a very good job of that, in my opinion, in our state. And I really see a huge need of that. So I work a lot with teachers on adaptive PE classes, and then also how to adapt PE so that every kid can be included in whatever the activity is in especially our elementaries and our middle schools. We have, with this work, we have 2 high schools that have adaptive PE classes, one at Henry Clay, one at Dunbar. They're doing great things. I've been assisting schools in creating wellness committees. We have a lot of employee wellness committees in our school, and I'm trying to connect employee wellness and student wellness and show that they're both important. So I'm trying to combine these two and create just one big wellness committee at each school with 1 or 2 people leading that. And so I've been going to a lot of my 10 champion schools, leading their first meeting, walking through the Alliance for Healthier Generation assessment, helping them create action plans, and then they say, now what? And so I get them to, I provide technical assistance of the now what? How do we implement these action plans? Whether it be developing a wellness policy. I've drafted a lot of wellness policies for our schools, to provide asking for feedback from families, using Google form on the wellness policy, because that's a big part of it. I've done a lot of presenting in schools on active classrooms, and the benefits on academic behavior and attendance, physical activity. Stephanie mentioned the paraeducator PD I did, and that was just, and I'm going back to this because it's talking about active classrooms and getting paraeducators to not only jump in and make sure they're supporting the students during specials and elective classes, but also how you can utilize movement and physical activity to de-escalate behavior. And how come, sometimes students are misbehaving is because they need to move. So let's change our strategy around how we, manage the behaviors, I guess, and utilizing movement. Like I said, coordinate with our employee wellness team to bring physical health to the program, the program, because our employee wellness team is focused on mental health. So trying to get the connection of physical health and or mental health and physical health together. Bringing all kids bike, my big vision goal dream, I guess, would be to have K1 bike education and bike safety in all of our schools being taught in PE classes. And so I had two schools that received the Paul and I grant from the Kentucky Department of Transportation last year. And so I have two schools that have a $9,000 set of bikes at their schools, or Strider bikes with pedal conversion kits. And it's supposed to be a 3-week unit. So that we have two more schools I applied for grants for that. You can see Mill Creek and Dixie Elementary. So we'll find out probably in 3 or 4 weeks and see if we can just continue to make a impact in biking. All right, Steph, next slide. Continuing, I do a lot of I've been trying really hard to collaborate with LFUCG, Lexington Fayette Urban County Government, with safe routes to schools, including a bike bus to increase walking and biking to schools and decrease accidents. I work a lot with the sustainability team in our district on outdoor classrooms, gardens, nutrition education. I already talked about paraeducators. I've been working a lot with the Friskies and the FACE team with wellness focus events. Just kind of whenever they have an event, just twist it into a wellness. If you have pizza, offer veggies. Have flyers on, the importance of movement, the importance of mindfulness, the importance of good nutrition, those type of things. Working with schools and bringing farmers markets to our school campuses. I live on Masterson Station, which is right by Sandersville Elementary. And we really don't have any, we now have some more grocery stores, but we don't have a ton of like farmers markets out in our area. You got to drive 15, 20 minutes. And so Sandersville piloted having Black Soil mobile food market come out to Sandersville. And they came out once a month in the summer, and they sold out every time. Ended up adding another one in October. And our neighborhood and our community absolutely loved having the farmers markets in our neighborhood right at our school campuses. What else am I doing? I am working on, so Stephanie, we mentioned the the Alliance for Healthy Generation Healthy Schools assessment that our schools do, which is fantastic. I've been using it for 15 years, maybe even 20 years as a teacher. But there's a couple of key components that I feel like it's missing that I would love to know what's happening in our schools. So I'm working with our district communication director. She does all the Qualtrics surveys in our district on creating Qualtrics Healthy Schools assessment that kind of has everything we want to know so we can figure out how to best support schools. And so that would also create a dashboard and really good visual representation and data around what's happening in our schools around the WSC model. And so is my big push right now, is trying to get that finished up so we can roll it out in the spring and kind of do a spring assessment of our schools. All right, Steph, next slide. Here's a couple, there's a set of the bikes at Sandersville, and we pulled them out and taught the kids. Again, they absolutely love them. It comes with a full set that comes with those racks and like I said, pedal conversion kits and the education for the teacher and the helmets. So again, I'm just working on finding funding to fund more of our schools. And then you see the picture on the left with Daniel Hill. He's over at Tates Creek Elementary. We helped fund, he was one of my pilot schools last year, so an outdoor classroom. So the benches and the concrete so they could get their students outside. And they actually, where he's standing, they have a beautiful garden. And so that's where they were like, we just need something, a place where our students could come out and sit so we can teach them outside by our garden. And then the middle picture we have two Rockstar teachers who are presenting to our teachers at our PD event. All right, next slide, Steph. One thing that I've been working on is also we are one of our high school chief. I guess high school, we call them high school chiefs. They're in charge of, we have two of them. They each have 3 high schools. They were in charge of the summer health and PE program. I don't know if you know this or not, but the only requirements of health and PE for the state of Kentucky is a half credit of high school health and a half credit of high school PE. That also can be, so that's the only requirement we have in our state. And then students are given the opportunity, at least in Fayette County, I don't know about other schools or school districts, but to take summer PE and it's basically a 2-week time frame. And they sign up. It's kind of like summer camp for 2 weeks or 10 days right after school gets out, and they can get their half credit of PE. And then they also have the opportunity to take online health through eSchools. And we've also offered a online PE course the last couple of years. So with all that said, as a person with PE and health background, I wanted to figure out how we can make this better for our students, make sure we're getting them what they need because it's so important, and they're doing it all in like 2 weeks in the summer. So we are we're discontinuing the virtual PE. We're only going to do in-person PE this year. And so I'm trying to streamline the registration payment process. It's kind of been a hot mess. They register on a Google form and then they have to remember to go back and pay on a different platform. So I'm working on that. We also we still have the option for eSchools if somebody absolutely has to do it, but we are going to offer our in-house in Fayette County schools. We have 2 teachers who are going to run an online health course that is focused on skills-based health education, which is all of our standards are what we call skills-based. We're practicing these skills and we learn the content through practicing these skills. And so these 2 teachers are going to run a 6 weeks Canvas course where students are having to turn in assignments and practice these skills week to week, versus just a reading and multiple choice, which was, again, eSchool, I'm sure has a great function for many people, but we want to make sure we are getting the students and meeting those standards. So been working on that. Stephanie, you can go to the next slide. We're almost done. There you go. Are there any questions? I know I just rambled a lot of stuff that I've been doing, but
I think your slide's getting ready to come up. So the last
I got it.
activity that we were talking, yeah, it can go many places.
Where I put it.
Yeah. The last activity within our work plan for the Fayette County is CDC is really big, and this actually is at the state level too. I'm surprised it's not an activity within the work plan for the statewide as well, but it's this disseminating accomplishments and lessons learned, and they're really big on success stories as well. So as Angela mentioned, she had 8 schools this year named within the group of America's Healthiest Schools. And then we worked with our Division of Communications in the Kentucky Teacher publication to highlight schools across the state that were named for America's Healthiest Schools with the Alliance, because Kentucky had the 3rd highest amount of schools named on that list behind California and Texas. And we know they have a bazillion more schools than we do. So we're pretty proud of the work in Kentucky. A lot of that comes from the work that Kelsey and his group do out at Baptist Health Deaconess Madisonville, working with over 120 schools in Western Kentucky that do this work, but also there are some other pockets, and they highlighted them. Barron County, that entire district, has what they call the All-Star Schools. So their schools got recognition in all 9 areas, which is amazing. So they're highlighted. And then the communications team also went out to Deep Springs Elementary in Fayette County to highlight them as well, because they were doing a lot of work, additional work, I guess I would say, because they were awarded for one area last year, but Angela worked with them and they were doing so many other things that we felt that they should apply for additional areas. And so I think it's the next slide. There we go.
Yeah, there you go. So those are the bullets are each area that they were awarded in. The other areas that you probably don't see here is basically teaching tobacco education, but you have to do it K-12. So it's just a hard one to incorporate with everything else to do. But we're hoping to have more than 8 schools be awarded this coming year. So you can go to the next slide. So Deep Springs and Sandersville got the most areas, and Picadone was right up there with them. But
okay, and then I'll real quick just kind of wrap up. So the work that we've shared so far is like the work plan and the activities that we do. In addition to that is always an evaluation piece, right? So how effective are we? And CDC will tell you this if you ask them, but we don't get a ton of funding. So in-depth evaluation doesn't necessarily occur. But we do the evaluation that is obviously required of us and a little bit of additional activity. So this is kind of give you an example and let you kind of see what we're also collecting in the background of all this work that's occurring. So we have to report monthly indicators, and that includes for all the professional development events and the number of recipients, the type of recipients, all the technical assistance. So Angela and I keep logs of the technical assistance that we provide, that we report monthly to CDC. Any schools in Fayette County that have completed school health assessments that are new for this school year, we report that. Schools in Fayette County that have developed an action plan. So Angela keeps track of that. A lot of this data for at least the assessments and the action plans we get from a report from the Alliance for a Healthier Generation, which is extremely handy, of course. And then there's some spots for comments of help that was provided that Angela might have provided for implementing the action plans. And then any, again, wins, lessons learned, and barriers, we report that monthly as well. And then in addition, we have an evaluation plan that has some set evaluation questions from CDC. We opt to add an additional one that I'll show you in just a minute. But it's basically, the first question is, how have our professional development technical assistance efforts prepared LEA statewide or districts and Fayette County to implement school health programs and policies? So we measure with all of our professional development if there were changes in knowledge and skills of any of the participants. A lot of that is asked on a formative evaluation, but also some summative evaluations as well. So that is one of the measurements. Evaluation question 2, have you increased the statewide school health infrastructure? So a lot of our work is building that infrastructure, those pieces that are sustainable to stay in place. So if people come and go, those committees are still in place and there's still assessments being done, et cetera, to improve the school health environment. So the annual process indicators under that one include this group here. The subcommittee is a piece of that. Just making sure we have representative membership and contributions from everyone within the 10 components of the WSC model, which we do. And then making sure this coalition, or it's called a coalition within CDC's terminology, but obviously we say subcommittee, that we set goals back in year 1, and those were to increase membership among some other partners, which we have done the past couple of years. And then also it's a chance for all of you all and us to connect and collaborate. So those were really the goals. In February, we are going to review these goals and see if we want to revise them. Not today, but just be thinking for February. And then districts in the state that have a school health council and schools in the state that have a school health team. So again, it goes really back to that big infrastructure piece of councils and committees. And I mentioned that we work with the co-ops, so we're tracking that. And then we do send a questionnaire or survey out, usually January, February to district health coordinators, food service directors, et cetera, asking them about if they have a school health district council, and then how we can provide any technical assistance in that area. And then question 3, that is still part of the CDC requirements, it relates directly to Fayette County. So this is just for them and the work within the district, but has a district council, which we've already talked about, that Angela oversees and meets quarterly. Schools that have a school health team, it's one of those evaluation questions. And again, Angela's working with schools for that as well. And then listing out and doing some focus groups of barriers and facilitators with action plans that schools are working on. And then this last piece is one that we were given an option you could to add some evaluation to the work. And we felt this was it's an easy win, but it's also very enlightening, these numbers that we report to CDC. And that really deals around school health services and supporting students with chronic health conditions. We collect the data through Infinite Campus and some required reports at the state level anyways. And so we just basically pull those numbers to include here, but it's looking at, you know, how many students across the state have chronic health conditions, asthma, diabetes, seizures, allergies, et cetera. Reporting those numbers, it really gives a great picture of what's going on in the state. And then there's always a question of, do schools have school nurses? Yes or no? You know, at what level? So that information is pulled as well. And then the amount of school nurse office visits is a huge thing as well. And then the back to class and things like that, that's tracked at least by districts that utilize Infinite Campus for this reporting. So that's an evaluation question we decided to add within our evaluation plan for Kentucky because we have that information readily available. Now I'm going to stop sharing, and that's the end of all of our information and update on the CDC grant. We've probably overwhelmed you, but please, if anyone has questions, please let us know. Yeah, Tina, go ahead.
Stephanie, thank you so much for that. I just had a quick question about the evaluation question related to visits to like the school nurse. Do you collect data on the nature of the visit? Like, would we have an indication if it's a mental health oriented visit or if it might be a physical health, or do we get into that level of detail?
And correct me if I'm wrong, Angie or Jim. Yes, that information is collected, doesn't have to be collected. So it may not be very accurate or always collected, but it will say different reasons, yes, for that
Gotcha.
office visit. So there's some data, just not complete.
Yep.
So to follow up on that a little more too, Tina, we are in the process this week of posting the 24, 25. Sorry, I'm trying to remember what year we're in. Health services data that will be on our website. So you not only will be able to see Fayette County, you'll be able to see other districts across the state, providing they are reporting an Infinite Campus. We do have a handful of districts that do not report an Infinite Campus. So, but it's very interesting to look at nurse count ratios, to look at immunization numbers, to look at a variety of pieces that you may want to take a look at. And once they're posted, I will make sure we include in these minutes, we'll include the path in which you can take a look at those if you would like to.
And we're hoping the February meeting will present those numbers to you all as well. Julie.
Actually, you just answered one of my questions about the numbers. The other question I had was, has there been any correlation with direct impact on student outcomes like chronic absenteeism, academics, behavior issues? Because I know through the early warning system and IC and Insights, there might be able to do some track to see what the impact is. Because like, I absolutely love all of this because, you know, we know that nutrition, health, sleep, all of that physical activity impacts academic achievement and the overall health of our students. So I'm just kind of wondering, are we able to show any correlation through some of the data that we have at Infinite Campus to start seeing what some progressive outcomes are?
I will say from at least more of the nutrition physical activity side, no, to be honest. That level isn't supported within the funding, at least for CDC. But what I will say is that didn't even mention this part of the evaluation, is that CDC also has us doing, it's called the Healthy Schools Questionnaire and the Healthy Students Questionnaire. The Healthy Schools Questionnaire goes usually to the principal, and this is just Fayette County. So it's really measuring the impact of the work there. As you can see, because there's such a focus within one district, for all the states that are funded, they had to work closely with one district. But it's asking a lot of the programs and policy piece, a lot of questions regarding that. And so that is done in the spring and April, and again, goes to principals and they answer those questionnaires, and CDC will be getting us the data back. They got us the raw data, but they're compiling it in a better format. There is a Healthy Students Questionnaire is another piece of that, and that's really measuring their levels of nutrition and physical activity and opportunities that they have within the school day. So that would be at least a direct impact of what's provided to them and what they're participating in, not necessarily their levels of health. But that is a piece of it as well. I will tell you the issue that we ran into this past school year when we implemented that is the active parental consent. We had a very low participation among the schools and the students with that information, that it's not really not very usable, to be honest. And so it's just something that, I mean, I hope one day we get past that in Kentucky and everyone's used to it and we can get those great data sources that we used to from students. But it did provide a barrier this past time. So sorry for that long answer, but at least on my end, not great correlation. Mike?
Yes, ma'am. First of all, congratulations on the amount of work that y'all are doing, not just with Fayette County, but your involvement through Strategy One with several districts and regions and co-ops throughout the state. Congratulations. It's an amazing amount of work. One thing I heard or didn't hear in Strategy One that I'm just curious about, one of the goals was to establish and strengthen with new partnerships. Has there been any consideration, and this really tagged on to me when you start talking about chronic absenteeism, has there been any thought or connection with the directors of people personnel? Because a lot of the areas that you're talking about, they are directly involved in. I was a DPP for 20 years. Ms. Piles knows that from my work in Boone County. But I'm just curious. If you're not partnering with the DPPs, I would recommend establishing a conversation with their board of directors, because there's so much overlap in with what you're doing through this cooperative agreement and the work that they do directly, but I didn't hear them mentioned in any of the partnerships. So long question, I'm sorry, but is there any thought to developing collaboration partnership with the DPPs, especially through their board of directors?
I don't know that we've had that conversation lately. We've worked with that branch with Rhonda Devine in the past and have presented at some of their, I think it was their regional meetings than anything, probably related more to the chronic absenteeism and the management of chronic conditions piece of the work. But I think it's a really good idea. I would love to have a conversation because I honestly am not sure how the nutrition physical activity piece of this would work. I think there's obviously the management of chronic conditions. There's a great fit. So I think that's a great idea. I appreciate that thought for sure.
And anything that I could do to help as a liaison between this committee and their board of directors, I would be happy to. First thought I'm thinking of is their annual conference in September that's held in Lexington. I see the work that you're doing needs to be a vital part of that conference. So anything that I can do to make that link happen. I was president of the board twice and still am greatly involved with that board. So anything I can do, I'm more than happy to work with this group and that group, because as I said, the work is overlapping. Everybody's doing the same thing. So we might as well share ideas and share partnership.
Absolutely. Thank you. I appreciate that.
Yes, ma'am.
Rachel?
Well, I love what you all are doing, first of all. Second, there was some really good research out of the University of South Carolina with a correlation between positive behavior intervention and supports that were being implemented in schools. They kind of had some pilot schools in Fayette County. The schools that you all are working with, a lot of those were implementing PBIs with fidelity. So I'd love to see the correlation between the schools that have those programs that are implementing PBIs with fidelity to see what their behavior looks like. Because the research from South Carolina was showing like the schools that were more intentional with kids with those chronic health conditions, more intentionality around the health portion in their schools was showing less behavior interventions that were needed, less behavior incidents. People didn't have to put out as many behavior intervention plans. So there was just a whole different, lots of different aspects that changed due to those programs. So I'd love to talk to you when you have time about looking into some of that, if you have time to do that. I mean, if that's something you'd be interested in doing, because when I saw the list of schools, I was like, ooh, that would be interesting to see that data.
Yeah, I would love to see the overlap and see what that looks like for sure. I love that idea. Thank you. Christina?
Yeah, I just want to kind of piggyback off the comment you made about like not being able to see the clear relationship with some of these efforts and changes in behavior or attendance and that kind of thing. We know that these are complex issues that students are dealing with that influence their attendance at schools, and so there may be more than one thing that's involved in that attendance. And if it's of interest, we could have, we don't do as much of the analysis. We do work more on the interventions in our division and helping districts and schools look at the data to drive their interventions in a very specific way through the sophisticated data tools that we have. But Leslie McKinney in the Commissioner's Office has been doing a lot of trend analysis over the past few years. And I think that data is probably ready for presentation to see how we are trending in the most recent school year compared to prior school years. So if that's something that would be of interest to this group at the next meeting, we could certainly reach out to Leslie, or you could reach out to Leslie, Stephanie. And if she's not available, I'm sure one of our staff could share some of that. But she's the one who's been doing a lot of the number crunching.
Perfect. Thanks.
My question, my question, I guess it overlaps with Rachel's comments, and I echo all of the compliments that have been shared. I think it's great work you're doing. But I was going to ask, as far as the evaluation component, is there any comparative analysis that you do with school districts that aren't participants of this particular grant program, either other areas of Kentucky or possibly even across state lines?
There is not. It's not a component requirement of CDC for that. And I think we call it a cooperative agreement as opposed to a grant because we work hand in hand with CDC on a lot of this work, but they are extremely understanding in that things change, right? Like states will have laws that are passed and we've got to switch gears, or just the landscape of anything, COVID, whatever it may be, things change. And so I think they realize that, yes, we're had to work closely with one school district. And in the past cooperative agreement, we worked closely with 9 school districts. But to do comparison would be the ones that aren't participating would be pretty hard, just because, again, things are constantly changing. Again, I love numbers. I love data. I love evaluation. Most of you know this about me. So it's really hard for me when I can't make direct correlations, but obviously have had to learn in this work that it's almost impossible with the capacity that we're given with the funding and the work that we do to make those correlations. And luckily it's not a requirement, which is why they lean heavily again on those success stories and things like that and those pieces and components, as opposed to like, did, you know, students increase their physical activity, because they know that's really hard to measure within that work. Sorry, probably not a great answer, but
I understand the struggle.
I know you understand quite well. Any other questions? Okay, Jim, I'll turn it back over to you.
Thank you. Thanks, Stephanie and Angela, for your presentation, and thanks everyone for your questions, your ideas, etc. I did want to mention one thing that is even a little more interesting, I think. In regards, there are currently 20 states that are funded through these CDC dollars in the current 5-year cycle. Kentucky, if you look at the total number of students that are to be impacted by these funds in all 20 states, Kentucky has 20% of the student population in the whole country based on this grant cooperative grant. So, you know, the work that Angela is doing every day, the work that Stephanie's doing every day is really going to be impactful in what this looks like across the country too. So to have your thoughts, your ideas, your encouragement, your constructive feedback, I think is important. And we want to hear that. We want to hear what's going on in your world that potentially we might be able to partner. And Mike mentioned partnerships. So none of this work can happen without partnerships. So everyone who's on this call, you're a huge partner with KDE, number one, and with school health, number two. So in saying that, I also don't want to downplay the role that Kelsey, when we talk about America's Healthiest Schools, Kelsey and his team in Western Kentucky, I know it was noted, but the phenomenal number of schools that are receiving their awards annually because of the work that they're doing. So thank you, Kelsey, and your team for that. But on our agenda, you see the second bullet item under our Healthy Schools updates. And this, we've had some internal conversations already about, you know, where, if you keep in mind the whole, the WSC, whole community, whole school, whole community, whole child framework that was redeveloped about 8 years ago now through ASCD and CDC in both an education and a health lens. You can see that there's a lot of things that's happened since then. There's a lot of things that has happened since January of this current year. So looking at it from the standpoint of what do we have in place? Where are our gaps still? And one of the items that I wanted to bring to your attention, we won't spend a lot of time on it today, but I would like to plant the seed for you to give us some feedback, is even within KDE, and we have other partners on the call as well, I think it's always helpful for us to understand where these pieces of school health reside and where they're functioning. So within the department, within our office itself, school and community nutrition resides, the CDC work resides, health services, school health services, and the work of our working with school nurses and district health coordinator resides. And transportation resides. But there are other parts within the department that the work goes on each and every day that is just as important as what we're talking about today. So really trying to connect those dots at the state level and how we can support one another each and every day and make our kids healthier, and not only healthier while they're in school, but healthier throughout their lifetime for generations to come. So I would encourage you to think about that and what that potentially might look like. What would help you wrap your head around these components and what it looks like in Kentucky, we would love to have additional conversation with that so we can begin to put some pins in that to say we're really moving the mark in this area, but we're struggling in this area, and who are some partners that we may need to reach out to that we haven't already. I'm going to move us on to our second presentation today, and I'm going to turn that over to Julie to talk about one of the other components that is in the WISC model, and that is parent, family, and community engagement. I'll get it out in a minute. So, Julie, if you want to take over the steering wheel and share your slides.
I will do. But first, I do need to make a disclaimer in that I am on the State Board of Education, also a member of this committee, but what I'm presenting is in a different hat. This is what I do for a living. So I want to make sure people understand that I'm sharing results from our research of a different role of my life with this committee. I'm not representing either of those parties in this. So I have to make this clear. A lot of the work that I do in Kentucky is virtually in partnership with other organizations just as a community member, because I want our kids to thrive. Most of my research or our research comes from the state of Delaware and the national work that we do. So that's what I'm sharing here today. But I have to make sure that's clear for everybody, so nobody thinks I'm doing something I shouldn't be. So what I want to talk about is in the family engagement world, a lot of family engagement events are compliance driven. They're driven by Title I. They're driven by, rules and regulations, and not driven by what our parents actually need. And so over this work that I've done for the past 10 years, I'm going to share about what the parents are telling us they actually want and need from us as a school community, as the whole school ecosystem. So let's see. Did I share? Yep. Okay. We're sharing. First of all, I want to share a quote from one of my favorite books, Dr. Seth Kaplan. If you haven't read this book, I highly recommend it. Really changed the way I kind of look at things. But really, it's all about what we need as human beings and to meet our social needs. And it's our villages and communities and what's happened and how we get them back, because our kids need villages raising them. Our parents are struggling, and they're struggling finding a support system to help them raise their kids. So this was one of my favorite quotes from that book. Also, one of our founding principles or founding people that we really look to, of course, is Brene Brown, and about connection. People really want to be seen, heard, and valued. And oftentimes what happens in family engagement is their presentations. They're given to people. It's information dumps and downloads. And what parents really want is they have experiences that they have had, maybe with their own child, with their grandchildren, and they want to share that with others because they've learned something. And then it validates us as human beings of, I have something to share with somebody else. I'm important too. So creating spaces for those connections to happen. And having dialogue. This is a lot of times in schools and in different environments, we're not really creating that space for actual dialogue to happen. And that's just freely flowing conversation. So many times it's scripted. We have to get through 5 or 6 questions. But then the real information and value and vulnerability happens when we have these freely flowing conversations. And so there's been quite a bit of research that's been done on just the value of connection. Harvard has one about the longest predictor, and this is perfect for this committee, of long-term health and happiness is the value of having strong relationships. And we wouldn't be on this committee doing this work if we didn't value that and know that to be the case. And also the value of belonging in the workplace and productivity. There's less turnover. People take fewer sick days when they belong. They feel part of a community. So how do we help schools make connections? Help them make connections. And it's by designing how we do family engagement. It's not having a sit and get. It's not having a meeting that's scripted with Robert's rules. It's not having just an activity, you know, the back to school nights, the carnival. That's not where the real connections are made. And so we have to engineer how we do family engagement. But also I would challenge our educators. We have to engineer our classrooms to meet the universal human needs. So this is from the Center for Nonviolent Communication. They're up in Minnesota, I believe. Now they're Wisconsin, Minnesota. And what they found are there are 64 human needs that we all have, and they're grouped into categories. And if you look on the screen, the biggest categories are connection and meaning. And if you look at these, when we are having family engagement events, are we designing them to be meeting these needs for people? You have completely different experiences and outcomes when we're designing for these needs versus designing for information downloads. One of my favorite ones is beauty. Like I am a huge nature person. And so if something is, you know, in an environment that's beautiful versus sterile, it gives you, it creates different feelings for you. But it's really, to me, is very interesting when we design for meeting these needs. Like the biggest one that we don't do for families oftentimes is autonomy, just creating choice when we're doing family events. So if you have an event, have 2 or 3 choices and let them go to what they want to go to. Don't create those spaces where people have choices. And so I often challenge people, have your traditional family engagement event. Ask people what universal human needs were meant for them. I would challenge them to say they're not going to get the same results. So by meeting the universal human needs, we ask right at the end of every parent camp, what needs were met for you? And it is crazy. Like this one, almost all the needs on that list were met. And if you notice, this particular event was done in both English and Spanish. We had rooms, the exact same 4 topics, 4 in English, 4 in Spanish. And the Spanish speaking families absolutely loved it because they got to speak in their native tongue. There wasn't a translator with that time lag. So the 6 surprising and delightful things. This is a presentation we give at many conferences. And this is from over 200 in-person parent camps that we've done and over 200 virtual parent camps that we've done. We started the virtual version right in COVID. March of COVID is when we started doing the virtual ones. We're doing it every single week. Virtual parent camps, all parent camps are free for anybody to attend. And it's just providing that time and space. And this is from 3,000 responses at all of those parent camps. First of all, is parents want to know each other. They want to know the parents of their children's friends and their classmates. Because when the child talks about little Johnny or Susie, they want to also know who the parents are. They want to hear other people's perspectives because they learn from each other. We're learning. When I hear somebody else tell a story, you know, I think, well, oh, and then it stays with me. They want the space and time to connect with each other and with school staff. So not parent-teacher conferences. Spaces where it's talking about things that are deep. What are your hopes and dreams for your children? 2 of our most requested topics lately is 1, of course, devices. How do I disconnect from my device? The adults and the kids, because they're addictive. So one of our partners, talking about partnership, is the Delaware Commission on Gambling, because that's where their addictiveness people reside. And so they constantly are facilitating sessions for us. The other one is, how do I regulate myself? And how do I help my child regulate themselves? Parents want those skills, and they want to be able to help their kids with those skills. Topics that matter to them, which I just referred to. They want to belong and contribute to the ecosystem. And of course, with Kentucky, we want vibrant family engagement experiences, just like we're talking about vibrant learning experiences. They want it to be fun. Okay. This has got the clicker on. So when people are connected, they walk out with the human needs are met, they're happy, they're warm, excited. They ask, when's the next time we're going to do this? It's kind of like going to a party. You know, when you walk out of a party, you feel really good. And it's like, I can't wait to come back and meet some more people. Seen, heard, and valued. And the one of the biggest things is they realize they're not alone. So in the virtual version, we have parents joining us from, we actually have kept track. It's all the states and territories and 7 countries. So we're talking a wide reach. And it's really cool when you have a parent from Guam talking to a parent from Alaska, talking to a parent from Delaware and California, and they all realize we're all struggling with the same things. And it's just very validating. Next one, let's see here. When people start talking about topics that are important to them, the shields and the walls come down and they start being more vulnerable and authentic, and it becomes a safe space. Parents' confidence rises when they start working with their kids, and it starts building the parent capacity for leadership. I'm a prime example of that. I mean, when I was a parent in Boone County, started getting engaged, became a member of the PTA, was president. I'm like somebody's over there chuckling. Eventually was on local school board. I went through, Pritchard Committee simple program. It just, it starts building the confidence and you do more and more things. And then the families realize just how deeply the educators care. I can't tell you how many times teachers and educators, staff members have been crying when the parents share with them how appreciative they are for what they've done for their child. And talk about a teacher retention tool. When the teachers feel that, man, that makes a huge difference. I'm going to kind of go through this fast. Let's see if it'll go here. There we go. Parents then start asking how they get more involved with the school, which again comes back to mental health for the kids, because if the parents are there, the parents know the educators, there's something that happens when the teacher and the parents know each other. It just affects the kids. It affects academics, it affects attendance, it affects behavior. Families want to come to events and they're happy they've made new friends. We now have people who think of coming to parent camp as a date night. Like we actually have groupies that they go to parent camps at schools that their kids don't even go to, which is really cool. So it's not about the event. It's not about the activity. It's about providing a space, the space for people to connect authentically. And by creating these spaces, we're triggering the brain. We're triggering the oxytocin. And when oxytocin flows, that's the major chemical for forming bonds. You feel trust, you feel connection. And it also creates another form of addiction, because your body wants that oxytocin, that feeling of happiness. People wonder, like, why I do what I do is because I get a high and a rush off of connecting with other people. So why does it matter? Why does a school ecosystem matter? I've mentioned it. Reduces chronic absenteeism, student achievement, reduces behavioral issues, increases mental health, reduces loneliness, which we know is one of the biggest impact factors on people. Assists with teacher retention. Study, the Nebraska Board of Education actually did a study, and they found interaction with parents as one of the main reasons they were losing teachers. Increases the job satisfaction and builds the village. And then I think this is probably one of my last slides. So this is another one of my favorite quotes from this book. Everyone feels ownership of the school. When you have ownership, you have hope, trust, and cohesion. And then your collective efforts just take off. So talking about how we partner, we're actually working with the Council of Post-Secondary Education. We're doing 2 virtual parent camps with them. They're providing the facilitators. We provide the platform because we've been doing this. There's no point in them reinventing the wheel. Council of Post-Secondary Education has a new website, Futurity, which is incredible. I love it. And for me, it's very satisfying because I was on one of the original work groups when we started talking about a platform like Futurity. So we're working with them. So on January 14th and February 11th, we're going to have different rooms, 6 rooms for people to choose from. Because share this with your family, share this with your school network, counselors, anyone, the educators, because it's there. We're providing this opportunity for people to connect and learn. And then we still do a monthly virtual parent camp. This month, we're actually partnering with one of our schools we work with in Delaware, and we're going to have a room in Arabic because that school has a number of Arabic families and they don't have communication tools and they know they're feeling isolated. Where I have a friend here in Boone County who speaks Arabic and has facilitated for us before, so she's helping us out with a room in Arabic this month. And again, you see digital devices, raising digitally happy kids. It's almost every month. We have a newsletter where we use the rule 80-20 marketing rule. Only 20% is parent camp news. 80% I pull from resources all over the place. That's just could be, grandparents raising grandchildren, how to raise happy kids. It's all kinds of good stuff in that newsletter. And that's also where you'll find our events, which we, not just our events, but partner events. So like NAFSCI and other organizations. We have a podcast. You see this guy here. He's also on the state board. He was one of our guests on our podcast, Dr. Poe, talking about from a superintendent perspective. And we're in our 2nd season on that. I think that's it. So hopefully that just gave you some food for thought when you're thinking about working with schools and things on family engagement, how to change it up to make it more engaging, more meaningful for families.
Thank you, Julie, very much. And we've had conversation with the Pritchard Committee and then Partners for Rural Impact, and in following their community schools model, parents and families are a huge piece of this work. And in all honesty, it should be a huge piece of all of our work when we're thinking about, even at the state level, how do we help districts and schools and communities work together for the good of that child. So thank you for your information. Does anyone have questions or comments for Julie? You have everybody
Yes.
thinking now, Julie.
Go
ahead, Mike.
Used to the pauses.
Julie, I just want to congratulate you on the work that you're doing. You've been a friend of mine for many, many years. I've had the pleasure of hearing you speak exactly to the research and the areas that you just presented on. And I wish we could take this message to all 171 school districts. It's not just our urban center schools that are changing. Our entire state is changing with the growth of a new populace, of a new culture, and your message is just so right on. So I just want to take a moment and congratulate you on your research, on this presentation, on the work that you're doing. And I'm so happy to call you my friend.
Thanks, Mike.
Anyone else? Dr. White.
Yes, when you mentioned Harvard in your presentation, I've worked with some folks at Harvard that are doing the Hope Center, where they're looking at positive childhood experiences, and one of their building blocks is community. Your community, your school community, your community you live in, and how important that community is. And they definitely see that people who have higher positive childhood experiences, it can buffer out the negative childhood experiences and make their health outcomes dramatically different. So this is exciting.
Yeah. One thing I was going to mention is we're seeing a lot of single dads because they are struggling. They don't know if they're raising their kids right, or especially if they have a teenage daughter. I mean, they're really struggling, and so that just has been really fulfilling, seeing them there and making connections, sharing phone numbers, and getting support. Kelsey.
Well, you touched my heart twice. You just did it again. When you spoke about the connection piece to the families, one of the avenues we're migrating our program, it's a regional program. We started at the school level with school wellness committees, and we're working our way up to establish stronger district wellness leadership group infrastructure while retaining that presence at the school level. So we're constantly looking for new avenues to focus on, and family and community engagement is one of our new focus areas. So we're always looking to have family wellness nights, connect to PTOs and such. So you touched me by talking about that safe space to build that relationship, to connect with parents, because we're always talking about, yeah, we do the wellness leadership infrastructure, and it's great we get the number of schools recognized every year. We don't want to downplay that. But at the heart of it all, we provide schools with academic classroom physical activity to get them moving. And hopefully, our program is set up to be K through 12 so that it follows them throughout matriculation. And hopefully they carry those habits into adulthood, which is our ultimate intended impact beyond the numbers and all of that. But if it's not reinforced with the family at home, to a large degree, your efforts will fall flat. So I wanted to commend you on that. And then I wasn't planning on saying this, but you got me again. I'm one of those single fathers. I have a 22-year-old daughter now, almost 23, but her mother passed away a few years ago and during her high school years. So I was a single parent raising a daughter. So I can relate definitely to that. So thank you so much. I just want to applaud you for your work there.
Thank you.
And I guess piggybacking on what was previously said too, I know Department for Behavioral Health, and many of you know Miriam Silman, is working very intently on partnership for Dr. White.
A resilient
Thank you.
Kentucky.
Thank you. And
Nice.
Dr. White has been instrumental in that as well. So I would encourage you all to take a look at that website. There's a bunch of research on it, other pieces that may be of interest, and we can include that in our follow-up notes for you too. But that's another great resource within our state. I'm going to turn it over to you all for a moment and see. We have two more things to do before we hop off here, but next, does anyone have updates that you would like to share with the group that relates to what we're talking about today, our school health and how we can support one another? If no one's talking, then feel free to unmute and go ahead.
Hi, Jim. It's Tina Robbins with the Kentucky Department for Behavioral Health, Developmental, and Intellectual Disabilities. I just have a couple of things I want to mention. One is I will, after the meeting, I'll send out our monthly opportunities, activities, and resources report. It's a pretty comprehensive listing of different things that you can take advantage of that our department is either supporting or coordinating with, and Park is probably listed on there. It may or may not be. I didn't check this month, but it's typically Miriam includes it on there, but there's lots of opportunities on there. So I hope folks will avail themselves to that report. I also, in another aspect of my life, am part of the Behavior Institute Planning Committee, and so I just want to make sure folks have June 15th and 16th on their calendars for the Behavior Institute at the Galt House. We're in the planning stages of that now. And then lastly, I am privileged to transition my role here on this committee to Lauren Penrose, who is on the call today. Lauren, as she introduced herself earlier in the meeting, is our school mental health program administrator in the department, and is a vital part of the Project Aware grant, and has been a huge asset and is a huge asset within our department around school mental health. And so because of some health reasons, and because I need to put you in very capable hands, I am just so happy that Lauren is going to be serving as the representative of our department officially as of now. So Lauren, thank you so much for doing that. I leave you all in very capable hands, and I would like to, Jim, if I can, schedule a time for you and Lauren and I to get together to do that, sort of give her an orientation to this group. And it has been my joy and privilege to be a part of this group for many years now. So thank you all.
Thank you for your huge contributions. And as I have mentioned to you, at any point, feel free to join us when you would like and have things to share. So we appreciate that very much. Who's next? Michelle?
All right, so I just have a couple of things to review. In September, we gave some input on the school sanitation regulation to take out disposable facial tissues and toothpicks and add standard first aid kit and equipment. The schools do have, they come from the local health department, and they do their they check to see if they have all the supplies. So we're working on that to get that more up to date. I think it was in the 90s when the last first aid list was made. So we're definitely give some input on that. The Kentucky Board of Nursing updated their advisory opinion, AOS 30, based on the new guidelines from the American Diabetes Association and the continuous glucose monitor. That was a pretty big thing. October also, we closed out our workforce development funding grant, and we were acknowledged for the 25 courses that we developed in the 3 years of the grant for school health workers, social workers, school nurses, etc. And then we submitted an article for the Kentucky School Health magazine on addressing declining vaccine rates. So November, we had a reorg over here. We are now under the Clinical Support Services branch. Our school health section is under the Clinical Support Services branch. We released our fall newsletter, and we also made available funding for flu and COVID testing to schools that they could request kits to give out to their families, to their parents, to have at the open houses, to have buckets and barrels of them for the parents and families to take. So we had several that did participate in that. December, our annual school immunization survey deadline is due, where the schools all have to submit their immunization data by, the deadline is December 31st. We have some big time personnel changes. Dr. White is retiring at the end of this month. Dr. Bada, who is, Dr. White has just been such an advocate for all things school health and helped us through COVID and lots of other things. And we'll miss her a lot. Dr. Bada is MCH Division Director. She's also retiring at the end of this month. And Dr. Lindsay Neese will assume the position of director. And we're very excited to have her. She's an OBGYN working at University of Louisville and done a lot of good things for marginalized families and women. Then we're going to do a presentation in the chronic absenteeism work group on the local perspective and how school nurses can make a difference as it relates to chronic absenteeism. I'm looking forward to that. And then updating our coding and billing document over here for local health departments and school districts that are employed or reverse contracts with local health departments, how their coding and billing goes. And then our MCH packages, the WISC package and the oral health education package is now on our radar for review. So that's it. And I'll send you a list. You don't need to write all that, Jim. I'll send it to you for your notes. So if anybody has any questions about any of that, feel free to ask. Sorry, I got a little emotional.
I'm going to save Dr. White for last. So I'll come back to Dr. White. Other comments or announcements, things you would like to share in your world?
Hi, this is Stephanie Barker with CAIOSA. I just wanted to share that we are currently working on an initiative with a few other state partners across Kentucky, aimed at expanding access to out of school time programs. So after school, summer learning, and anything in between for kids across Kentucky, really to address the youth mental health crisis and ensure that all kids have access to those positive childhood experiences like that were talked about earlier on this call. Can't say much more about that right now, but we'll have a blog post coming out soon, hopefully before the end of the year, that will kind of discuss that work in more detail. But you know, kind of tying in with that and why we're doing that work is last month some really important data came out. I know some folks on this call really like data, so I thought I'd share. So about every 5 years, our national partner, the After School Alliance, and some other research partners, they conduct a national household survey across all 50 states. We get state level data showing what demand and participation look like for in out of school time programs across every state in the country. And that data was just released back in October, I believe on October 15th. And you can go to our website. We have those findings on our website live and links to the partners' research as well. There's a fact sheet on the website that you can also download called Kentucky After 3 p.m. And it shows how many kids would essentially participate in these programs, you know, and, you know, thinking broadly, you know, these are really positive childhood experiences that really are a proven strategy for addressing youth mental health, you know, combating chronic absenteeism, et cetera. And so what they found in Kentucky was that essentially 5 and 6 kids across the state, you know, averaged out, are missing out. So these are kids that would participate in a program if one were available to them. So roughly that's about 56,000 kids in a program and almost 290,000 that don't have access. So that's some really important research I thought I'd just share. But stay tuned for more updates on what we're working on to try to expand access statewide.
You're putting the carrot in front of us and keeping pulling it along, so we have to follow you, right?
Yeah.
Thank you.
Definitely check out that data.
Absolutely. Others? No one else? Couple of things. One, I would like to remind everyone our next meeting is going to be February the 3rd. And that will be virtual. If you joined us a little late, we will just continue. The next 2 meetings will be virtual and then hope to be in person again in June. But I would also, as we wind down this one, I want to remind folks of one more thing. As has been mentioned before, we know Dr. White is stepping away from her current role. Not sure how she's going to survive without having to put out the many fires that she has to each and every day. But she has been a part of this group for quite some time. I know Angie, especially, and many of you during COVID, that was a chapter that probably none of us want to relive. Our former associate, Robin Kinney, and Dr. White worked very closely with Angie at the time, and really trying to set some precedent as to how we were going to maneuver through this. At one point, Michelle was at the Department of Ed as well as part of our team, but there are many things that Dr. White has done to support our work at KBE, and I think many of you all who are part of the subcommittee. So, Stephanie, will you share your screen, please? And I think most of you have seen this, but we want to make sure that next week, if you are available to come and wish Dr. White well in her retirement that KDPH is having for her. So I'm sure she would love to see you in that regards. But I want to publicly acknowledge and say thank you, Dr. White, for everything that you've done for us and for the kids and families across the state.
Well, thank you, Jim. You're very kind. I'm surprised, but would love to have you come eat ice cream with us. I mean, even if you don't know who I am, come. We got free ice cream and toppings. Yeah, I've been in this position since 2012 when I started as the deputy commissioner in this role. And I wish I could tell you who's going to be in my position next time, but I can't quite yet. But I will reveal you're going to love her. She's someone who's going to be very energetic and helpful for this team. But thank you. School nurses are part of my heart. And Michelle knows that, and the other folks do. So, yeah, we went through a lot, and I learned a whole lot about KDE that I had absolutely no idea about. But it was a growth experience for me, and I was delighted to learn the people, the process, and know that we were trying to help the kids and the teachers and the staff. Thank you.
So, Dr. White, I'm going to put you on the spot just in a second. But I'm going to ask you to give us some parting words for this group, knowing what you've been involved in over the last few years and what you maybe hope or wish of this group in the future. Christina, I think you raised your hand.
Well, I don't want to interject in front of Dr. White, but I did just want to say that she. Now I'm getting emotional, but she really did so much for us as we started to embark on the work around trauma-informed practices. And I still repeat a story that she shared about adverse childhood experiences at our Persistence to Graduation Summit to help people understand. Sorry, this is surprising me, but but the link between adverse childhood experiences and health outcomes, and just asking some questions and being curious without being judgmental about what might have led to a behavior has been just a huge shift for the work that our team does. So just thank you so much.
Thank you, Christine. That's been a long time ago. That conference was a long time ago. Yeah. Hi, Stephanie.
Well, I won't get through this without crying, so we'll just call it what it is. I can't thank you enough for your work and your support of school health and our roles and work over the years. I've been doing this a while and CDC funded and wouldn't still be here if it wasn't for Dr. White, because they changed the structure of the funding at one point, and it all went to public health, which was fine. But she fought to have us keep some of the funds at Department of Ed because she understood the importance of school health. And I can't thank you enough. Your love of YRBS as well. I always knew I had your support with that data. I mean, I really could go on and on. I just appreciate you as a human being. I have always loved talking to you, joking with you, your perspective on everything. I admire and value, and I will miss you terribly, but am very excited for you and all your travels. And just know I love you and thank you so much for everything.
Thank you.
Angie.
Okay, I don't even know what I'm going to say, but I'm probably going to choke up too. So let's just get it out. I just think back to when the COVID bomb dropped. I was very new in my role as state school nurse consultant. And within just a matter of few hours, our whole world just turned upside down. I was called to the commissioner's office, who I'd never even spoken to before, being told that we were going to a press conference that the governor was giving about COVID. And then, you know, the next day we're all in a room trying to close the schools. So, and I'll never forget you coming up to me and giving me a hug and says, "We're going to get this. Here's my phone number. You call me anytime." And you supported me, and you gave me and Michelle so much encouragement, and you loved our school nurses, and you talked to them on every webinar we had and loved them and told them what a great job they were doing. And you got it. You got us, you know, and I'll just never be able to thank you enough for what you've done for me, just personally, emotionally, and professionally. And you're my hero, and I love you.
You're very kind. Thank you. It's not hard to be kind to school nurses and the folks at KBE that I've been able to interact with over these years. It has been a delightful time for me. And I would just say that having these meetings and learning all the things y'all are doing besides teaching kids, you know, writing, see, I don't even know what the 3 R's are: reading, writing, arithmetic. There's so much more, which is the WISC model. And continuing to do this work and learn from each other, because if somebody's doing a project over here, it's like, ooh, we could take what you're doing and add it to what we're doing and morph it. I learned in public health really quick, no matter who gets the credit, as long as the outcomes happen to help our kids and to help our staff and to help our teachers and to help people that spend every day in the classroom, because I know I don't have that kind of patience or skill set. So I'm so grateful that they're there, and anything we can do in the background or even out in front to help them survive and succeed. And I like to use the phrase setting people up to succeed. We've spent enough time in our life setting people up for failure. So setting people up to succeed is a great joy. And I won't say I've enjoyed every day, but I've enjoyed most of it, a lot of it. And your kind words are very sweet. Thank you to everybody.
Well, to you, Dr. White, and to Dr. Robbins as well, you all are welcome at any point in the group. And we appreciate your contributions and the work that even unofficially you'll still do on behalf of Kentucky kiddos. But thank both of you very much. And we will conclude today's meeting. Hope everyone has a great holiday season. Take some time off, enjoy family, enjoy time for yourself. And we will follow up with meeting notes as well. If you need anything in the meantime, please reach out to us. Thanks so much.
Thank you.